Good evening, Prof. My name is Harsha Kaur from BMI Cohort 10, and today I'm going to be presenting on ultrasound or chest radiography used in detecting hemothorax. Okay, so clinical scenario. A patient who suffers from a traumatic injury to the chest arrived to the emergency department complaining of having shortness of breath and chest pain. The signs and symptoms of patient show that the patient is having hemothorax. The ideal diagnostic study for detecting the hemothorax is ultrasonography test. And to confirm the diagnosis of the patient's condition, the physician is wondering whether other imaging studies, such as chest X-ray, may provide a more accurate, detailed image to detect and further assess the patient's condition. Introduction to pathology. Okay, so hemothorax refers to the collection of bloody fluid between the chest wall and the lungs. Hemothorax occurs due to chest trauma from penetrating injuries or surgery which damages the lungs, vessels, or even the chest wall, which causes the blood to accumulate at the pleural cavity. The buildup of the blood in the pleural cavity will lead to the collapse of the lung as the blood pushes from the outside of the lung. Symptoms of hemothorax include chest pain, feeling of heaviness on the chest, pale skin, abnormally fast heartbeat, cold sweats, and high fever. Okay, so these are the examples of images. As you can see here, this image here, this shows the difference between pneumothorax and hemothorax. So pneumothorax is the accumulation of air in the pleural cavity. Hemothorax is the accumulation of blood in the pleural cavity. Okay, so this image here in the middle shows is a chest X-ray showing the hemothorax, as you can see here, and the image on the right is a ultrasonographic image showing the pleural fluid in the pleural cavity. Okay, formulating a focused question. So the clinical question category would be diagnosis category, which refers to the process of identifying the disease or a condition and also help to choose the correct diagnostic test in diagnosing or detecting the problem. Okay, formulating a focused question. So we're going to use PICO. So patient will be the patients. Intervention would be ultrasound, comparison would be chest radiography, and the outcome would be to detect hemothorax. Clinical question. Okay, so the clinical question is the ultrasound better in detecting hemothorax as compared to chest radiography among patients? Okay, and then the study design is cross-sectional study with consecutive sample. Okay, so the search strategy that I use is Medline, and the key points that I use are hemothorax and ultrasonography and chest radiography and patient, or chest trauma and chest ultrasonography and chest X-ray and public, or traumatic thoracic injury and ultrasound imaging and radiography and adult. Okay, so the search outcome, okay, so I found 50 papers were found, and out of the 46 were rejected due to irrelevant or insufficient quality. Manual searching not found, and out of 50 papers, 4 papers were selected. Okay, so these are the articles that I have found. So author, date, and country for the first one, for the first article, Vafe A. ETAL 2016, Iran. Patient group will be 29 patients with chest trauma undergoing chest ultrasonography and radiography in detection of traumatic intrathoracic injury. Study type would be prospective. Cross-sectional study. Outcomes would be detection of hemothorax was 0.86, 95% confidence interval 0.78 to 0.94 by ultrasonography, and then the detection of hemothorax was the detection of hemothorax for radiography was 0.77 with the 95% confidence interval of 0.68 to 0.86. The key results would be the diagnostic value of the ultrasonography and radiography test used was equal in detection of hemothorax with a p-value of 0.08. And then the next article will be Ma OJETL 1996 USA. Patient group will be 204 trauma patients undergoing ultrasonography and initial test radiograph for detection of hemothorax. Study type will be retrospective study. The outcomes will be both ultrasound examination and the initial chest radiograph resulted in 0 false positive, 1 false negative, 25 true positive, and 214 true negative findings of hemothorax. Key results would be overall both modalities were 96.2% sensitive, 100% specific, and 99.6% accurate. Okay, so the next article would be Movagar VR ETL 2016 Iran. Patient group would be 7,361 patients were extracted and included from 12 studies into the meta-analysis. Study type would be systematic review and meta-analysis. Outcomes would be sensitivity and specificity of ultrasonography were 0.67 with 95% confidence interval 0.41 to 0.86 with a p-value of less than 0.001 and 0.99 95% confidence interval 0.95 to 1.0 with a p-value of less than 0.001 in detecting hemothorax. The sensitivity and specificity of radiography were 0.54, 95% confidence interval of 0.33 to 0.75 with a p-value of less than 0.001 and 0.99, 95% confidence interval of 0.94 to 1.0 with a p-value of less than 0.001. The key results would be the sensitivity of ultrasonography in detection of hemothorax is higher than radiography, but it is still at a moderate level of 0.67%. However, the specificity of both imaging modalities were at excellent level. Okay, the last article will be Stout LJETL 2016 Brazil. Patient group will be 620 patients with chest trauma. Study type would be systematic review and meta-analysis. The outcomes would be the sonographic sign for hemothorax was an echo pool or anechoic area in the pleural space with a sensitivity of 0.60, 95% confidence interval 0.31 to 0.86. Specificity of 0.98, 95% confidence interval 0.94 to 0.99. LR positive of 37.5, 905% confidence interval 5.26 to 207.5. LR negative of 0.40, 95% confidence interval 0.17 to 0.72. And the key results will be chest ultrasonography is an accurate tool for the diagnostic assessment of traumatic hemothorax in adults. So the comments will be, aside from CT scan, ultrasonography and chest radiography are the two ideal diagnostic imaging methods used in the initial evaluation of patients with hemothorax. However, for patients who have traumatic thoracic injury, ultrasonography is considered an accurate tool in detecting hemothorax because it has a higher sensitivity as compared to chest X-ray and has an excellent specificity just like the chest X-ray. Ultrasonography has also an added advantage as it helps to detect hemothorax in a shorter period of time as compared to the time taken by chest X-ray. Okay, so clinical bottom line would be ultrasound is a better diagnostic imaging tool used for initial assessment of hemothorax in patients with chest trauma due to its high sensitivity and specificity. These are the references used, and that is all from me. Thank you.